Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 096. A newborn with gestational age of 31 weeks presents with hypotonia and depressed consciousness. Hematocrit is 35%. General cerebrospinal fluid analysis shows increased content of erythrocytes and protein and low glucose. These data correspond with the clinical presentation of A. Intracranial hemorrhage. B. Intrauterine infection. C. Meningitis. D. Anemia. E. Sepsis. Preterm is defined as babies born alive before 37 weeks of pregnancy are completed. Subcategories of preterm birth: extremely preterm, less than 28 weeks; very preterm, 28 to 32 weeks, moderate to late preterm, 32–37 weeks. Hypotonia is a condition of decreased muscle tone. It most commonly affects a newborn's motor skills. It is often the symptom of an underlying medical condition. Intracranial hemorrhage is a potentially devastating event in pregnancy. There is a risk of maternal mortality or morbidity and a significant risk to the unborn child. It can be extradural, subdural, subarachnoid or intraparenchymal. The risk increases during the third trimester and is greatest during parturition and the puerperium. The causes include trauma, arteriovenous malformations, aneurysms, preeclampsia, eclampsia, and venous thrombosis. Cerebrospinal fluid (CSF) analysis is used to measure different substances in the CSF to diagnose infectious diseases in the central nervous system, including meningitis and encephalitis, looking at white blood cells, bacteria, and other substances in the CSF. Autoimmune disorders, such as Guillain-Barré syndrome and multiple sclerosis, looking for high protein levels in the CSF. Cerebral hemorrhage, brain tumors, Alzheimer's disease. Hypoglycemia, a low glucose level in the CSF, is commonly associated with infections such as bacterial, fungal, and tuberculous meningitis. CSF is normally clear and colorless. Abnormal CSF may appear cloudy, turbid, bloody, viscous, or clotted. Erythrocytes should not be present in normal CSF. When erythrocytes in CSF are due to a traumatic tap, bloody tap, a visual comparison between the first and last collection tubes will show a significant decrease in color. There will be no color difference in the case of a hemorrhage. Traumatic tap is an accidental trauma caused to a blood vessel during a lumbar puncture. The answer is A. Intracranial hemorrhage.